Well, the number of people infected with coronavirus surged by more than 3,000 overnight, with more than 20,000 confirmed cases in China. And there's a growing number of pending tests here in the United States.
Let's get more on the testing delay with health reporter Stephanie Stahl.
That's right. We have some delays to tell you about. The CDC lab in Atlanta, the only place currently testing samples for coronavirus, has been overwhelmed. So there is watchful waiting around the country, including at Princeton in New Jersey. Princeton University had initially been monitoring 100 students who recently visited China. No one has been sick or symptomatic. One student is still being assessed. Some are in self-quarantine, even though the university says it's not needed.
If I go to work, I'll put my co-workers' health in risk, so I don't want to do that. That's why I want to stay home and work from home.
In the U.S., officials have identified a second person-to-person transmission, this time in California. The CDC is currently monitoring 82 people for potential infection.
It seems that the virus spreads fairly easily when you're not isolating cases quickly.
Cases in the United States so far have not been serious. Worldwide, coronavirus cases have spread to more than 24 countries. 2 deaths have been identified outside of mainland China. In Hong Kong, more than 2,000 striking medical workers are demanding the government close its borders with mainland China. Hong Kong now has 1 confirmed death and at least 15 cases of the virus.
There's a significant risk of community transmission in Hong Kong.
In Japan, health officials quarantined thousands of cruise ship passengers after a Hong Kong man who sailed on it last month tested positive for the virus. And Australia has sent hundreds of evacuees from the epicenter of the outbreak to a remote island in the Indian Ocean to monitor them for symptoms. The World Health Organization called some countries' restrictions excessive.
There is no reason for measures that unnecessarily interfere with international travel and trade.
Now, today, the U.S. government announced it was making nearly $250 million in emergency funds available. Some of that will be used to cover the costs of screening and monitoring returning U.S. citizens in the coming weeks. Still, it's been pretty limited here in the United States so far.
Very much so. Okay.
Thank you.
Thank you so much. Kate joins us.